back to my channel, Time with Nurse Joycelyn. If today is your first time of watching my videos, kindly like and share my videos for me. Subscribe to this channel for me and put on your notification bells for new updates. Thank you. Today, let's talk about the human metapneumovirus. Yes, I hope you are shocked at the name. This is actually a name of a virus, a certain virus, which is responsible for causing upper respiratory infections. The virus actually causes symptoms that are similar to that of common cold. It causes upper respiratory infections, but sometimes can cause lower respiratory infections such as pneumonia, asthma flare-ups, and can also make chronic obstructive pulmonary diseases worse. This virus causes symptoms like runny or stuffy nose, difficulty in breathing, or shortness of breath, dyspnea, medically called. It can also cause rashes or wheezing. These are the symptoms you get when you are infected with this HMPV. Let's talk about how you are going to go about it when you are infected. I mean, what you are going to do when you have the infection and how you are going to prevent it. Stay tuned. The HMP virus spreads through direct contact with someone who has the infection or through touching surfaces that are contaminated with the virus. For instance, coughing, sneezing, wheezing, or coming into contact with things that are contaminated with the virus. Those things can be toys, keyboards, phones, or doorknobs. The human metapneumovirus, or the HMPV, it's a small germ that uses cells to make more copies of itself, and it is part of the group of viruses that cause mumps and measles. Now, the risk factors. You are at a higher risk. Any of us can get the infection, but you are at a higher risk if you have a compromised immune system from conditions such as HIV or any autoimmune disorder. If you are above the age of 65 or if you are under the age of 5 years, especially in premature infants. If you are also having asthma, you are prone to getting this viral infection. The HMPV is not as fatal as the coronavirus, but can sometimes cause complications that may require hospitalization. These complications include bronchiolitis, bronchitis, pneumonia, asthma flare-ups or COPD, chronic obstructive pulmonary disease. Also, you can get otitis media or an ear infection. We normally don't cure viral infections. We manage the symptoms. So, most symptoms can be managed at home until you get better. In cases where you don't get better or these symptoms persist, you quickly reach out to healthcare providers so it can be managed. They can monitor the symptoms or the condition until you get better and prevent further complications. We, the healthcare providers, might treat you with oxygen therapy in cases where you're having trouble breathing. We use IV fluids to keep you hydrated and also corticosteroids to reduce inflammation and ease some of the symptoms. Do you need an antibiotic or antibiotics for HMPV? No. HMPV is a viral infection. We use antibiotics in the treatment of bacterial infections. We manage the symptoms of HMPV, but sometimes people who get pneumonia as a result of the HMPV also get other bacterial infections. So if your healthcare provider is prescribing antibiotics when you have this viral infection, it would be to treat the secondary infection, which is a bacterial infection and not the HMPV. How do we prevent this HMPV? You can reduce your risk of getting the virus or contracting the virus by washing your hands frequently with soap and water. In the absence of soap and water, you can use an alcohol-based hand sanitizer. You make sure you cover your mouth and nose with the elbow and not the bare hands if you cough or sneeze. You avoid being around people who have contracted the infection, or if you can't do this, you wear mask when you are around them. You avoid sharing food items or eating items like forks, spoons, and cups. This is the end of the video for today. Remember, HMPV is a viral infection. Even though we can't cure it, it's manageable. Don't ignore the symptoms when they become persistent. Reach out to healthcare providers for assistance and support. Until I see you in my next video, kindly subscribe if you've not done so yet. Like and share the video for me, and also keep your comments coming. Thank you.